morning. Okay, patient privacy. My name is Sitlande. I'm going to be your nurse today. Can you tell me your name and date of birth?
Nuni Saisana 110988.
Okay. Can you tell me the reason why are you here?
Checkup.
Okay, so I'm going to ask you a few questions and tell you vital signs and also touch you. Is that fine for you? Okay, can you tell me the year?
2025.
2025. Okay. Do you know where are you right now?
Clinic.
Okay, so patient is well oriented and is for to time, place, situation. Okay. So do you have any pain, discomfort? Okay, looking at patient is calm, relaxed. I don't see any sign of distress. Okay, so we start taking the vital. Okay. It's funny that I use your right arm. Okay, so it's 120 over 78 is fine. Okay, now we check for your oxygen and also your temperature. Okay. Okay, we put this under your tongue. Okay, so it's 98.3, so it's good. Okay, and for oxygen is 98. Okay, so now we check for your pulse rate. Okay, can you give me your right arm? Okay, I will feel your pulse for a full minute. Okay, so your pulse is 64 and respiration rate is 14, so you are pretty normal, and the chest rise is even. Now I will check for your carotid pulse. Okay, rhythm is regular +2, and also we hear the sounds. I don't hear any birds. So now I will start palpating your skull. Okay, so we expect. And do you feel any tenderness or pain? Okay, so we'll also check your sinuses. Do you feel any pain, tenderness? No. Okay, so looking at your face and your eyebrows and eyelashes are well distributed, and your eyes, your pupils are black and round. Your sclera is white. I will check your conjunctiva is pink and moist. Okay, so we check for your pupil constriction. Okay, so just look straight to the wall. Okay, so pupils right to light. That's and also can you follow the pen light without moving your head? Okay, so that is to check cranial nerve 3, 4, and 6. Okay, so now we check your ears. Do you feel any pain, tenderness? Okay, I don't see any swelling, drainage. Okay, no inflammation. I will whisper something to you. I want you to repeat that word, okay? White car.
White car.
Blue shirt.
Blue shirt.
Okay, patient could repeat the words correctly. Okay, so now we check your nose. So the septum is straight and midline. Okay, so the mucosa is pink and moist and red. I will check now your cranial nerve. One for a smell. Can you close your eyes, please? What do you smell?
Alcohol.
Alcohol. Okay. Now we check your mouth. Can you open, please? Okay. So gums, oral mucosa, and tongue is pink and moist. I don't see any bleeding, inflammation. Okay. Now can you open your mouth and say ah? Okay. So uvula moves well. It's a straight midline. And can you stick out your tongue and move side to side? Okay, so that is to check cranial now. Can you put your tongue up? Okay, so I see that is moist and pink too. Okay, so cranial 10, 9 and 11 is intact. Okay, now we check for lymph nodes. Okay, do you feel any tenderness, pain? Okay, I don't feel any nodes. Okay, can you move your neck to one side? Okay, to another. I don't see any GBD. Now I will check for your carotid pulse. Okay, rhythm is regular +2. And also we hear the sounds. I don't hear any birds. Okay, so now for the skin, the color is normal, uniform. I see the skin is smooth and dry. I will check for your temperature. Okay, I feel it's warm. I will check your capillary fill. Okay, so for feet and hands is less than 2 seconds. Okay, skin sugar is less than 2 seconds. Okay, so now we check your back to hear your lung sounds. Okay. Okay, so take a deep breath every time you feel my stethoscope move. Okay, we check. We start from the right, then to the left, and all the way down into the base of your lungs. I will hear for a full minute. I will check for your spine. I don't feel any deviations. Do you feel any pain, tenderness? Okay, so I will check for kidney pain. Do you feel any pain, tenderness? Okay. Oh yeah. And I will check for symmetrical expansion. Okay, take a deep breath. Okay, so my fingers move symmetrical and original to position. Okay, now I will start with your cardiac. So I will hear your cardiac landmarks. Okay. Okay, so we start with the aortic, then pulmonary, herbs, then transcuspid valve, and then under the breast with mitral valve. Okay, we keep for a full minute. All right. Do you smoke, or you have any cardiac diseases? Do you exercise?
Yes.
Okay. So now we need you to lay down to check your vocal sounds. Okay. So I will inspect your abdomen. I don't see any scar lesions. Okay. Skin is smooth. So now I will hear your bowel sounds. I will start with your lower quadrant and then move to all the way around. Okay, so I will here for 5 to 30 clicks for 1 full minute, and now I will continue to percuss. Okay, I don't hear any breaths. Okay, now I will palpate all the 4 quadrants. Do you feel any pain, tenderness? Okay, now you can sit down. When was your recent
This morning.
move? Okay, do you have any change in your bowels?
Normal.
Okay. And do you see any blood in your stool? Okay. Okay, oh yeah. I will check for your radial pulses and also dorsal pulse. So it's regular +2. Okay, now I need you to stand up and walk to the green light, then come back. And now can you stand just for 30 seconds with your eyes closed to do the Romberg test. Okay, so patient well balanced. Okay, now you can see the gait is normal, well coordinated, and posture is right. Okay, can you show please your resist? Okay, that's to check cranial nerve 11. Okay, now can you touch my index to your nose? Okay. Okay, now on the other side too. Okay, now can you move your right heel to the knee up down, and then the other side too, and with your eyes closed. Okay, that's good. So now we check for your reflexes. Okay, I will check your tricep reflex. Okay, now the patella. Okay, that's good. And now we check also the other side too. Oh, okay, now can you put your hands and feet and squeeze my fingers? Okay, the other side. Okay, so patient could follow my orders and coordinate and smooth. Okay, now I will do the knee resistance. Okay, that's great. I think I'm done with everything. So now we check the patient's safe environment. I will put her stuff close to her and put the cowbell. Okay, so the doctor will come in soon. If you need something, just use the cowbell. Okay, have a nice day. Oh.